So now first let me tell you about the thoracic duct. So the thoracic duct, what is thoracic duct? It is the largest lymph vessel present in the body. So what is the origin of thoracic duct? What is the course and relation? Then how does it terminate? Okay, it is the lymph vessel in the body, so it will have tributaries and area of drainage. Tributaries and drainage. And finally the applied aspect. So this is how we will be studying about the thoracic duct. So what is the origin of thoracic duct? Thoracic duct we have seen where, in which part of thorax? We have seen it in the mediastinum. We have seen it in posterior mediastinum and also in superior mediastinum. So now let us study. Before understanding everything about thoracic duct, it is important to draw a very simple diagram. This diagram is important to understand the relations of all the structures in posterior mediastinum. So please take down this diagram. So let us say this is the T12 vertebral level. Okay. There is a lymph vessel in the abdomen called cisterna chyli. It is like a cyst, like a sac. Cisterna chyli is a lymph sac which lies in front of L1 and L2 vertebral bodies. It has a blind lower end. The upper end continues as a thoracic duct. And the thoracic duct has a beaded appearance because of numerous valves present in the thoracic duct. And while performing the surgery, it may appear colorless. But in the cadaver, it resembles a vein. You don't get the beaded appearance like this because the muscle tone, the tone of the muscle in the wall of thoracic duct is lost. So it will resemble more like a vein, an ordinary vein. But when in living condition, when you do the surgery, you can see a beaded structure like this. It consists of beads, lot of beads, due to the presence of numerous valves. So now from the abdomen, in the abdomen you have the cisterna chyli. So thoracic duct begins as the upward continuation of cisterna chyli. Now from the abdomen it has to enter into thorax. So how will it enter? It passes through the aortic opening present in the diaphragm. So now it is running up in the posterior mediastinum. So when it reaches the T5 vertebral level, T5, so this crosses from right to left. It crosses from the right to left. And now it is running along the left edge of another structure. What is this structure? This structure is called esophagus. Small part of esophagus is shown. Okay. Now it is running up in the superior mediastinum along the left edge of esophagus. Now what will happen? It enters the root of the neck. Now it is seen in the neck, in the root of the neck. So here at the level of C7 vertebral level, it arches, it makes an arch and opens at the junction of two veins. What are these veins? You have the left internal jugular vein and left subclavian vein. So what will happen when these two veins join? The left internal jugular vein and the left subclavian vein. When they join, you get left brachiocephalic trunk.